Yeah, we've been pretty at or near capacity on some units, over capacity for the last several weeks.
Local hospitals on high alert as a surge in COVID-19 cases brings an influx of patients. The surge in cases also making it tough to get tested. Good evening, everyone. I'm Brooke Martin.
And I'm Phil Sanchez. Thank you for joining us tonight. Several hospitals have installed tents or similar structures to handle the overflow of people coming into emergency rooms. IT-Mate's Richard Essex joins us outside Methodist Hospital.
Methodist IU Hospital put up these tents in April as an overflow for the emergency department. During the first wave of the virus, the hospital wanted to have additional space ready for the surge in patients. So far, the tents have not been used. But as positive cases of the virus continue to surge, Methodist has decided to keep the tents in place. Franciscan Hospital on the south side of town has set up semi-permanent COVID-19 testing locations on their campus. The metal buildings are similar to carports or storage buildings. The hospital had these buildings installed in late spring in anticipation of a surge of patients.
Well, I believe that the treatments we're using are working. There are still plenty of patients getting sick, plenty of patients getting critically ill.
The drive-through clinics on the Franciscan campus isolate potentially infected patients away from the emergency room and other parts of the hospital. Franciscan Hospital gave IT-Mate some never-before broadcast pictures of their staff working through this current surge. Nurses and other medical staff are stretched thin at Franciscan and other hospitals around the state.
We don't have a lot of reserve forces to bring in, so there just aren't excess healthcare workers out there who can step in when you have folks that are sidelined like that.
HIPAA regulations prohibit the use of any pictures of patients. We are told by hospital staff that several medical units are at capacity or over capacity and have been for several weeks. The number of patients on ventilators had dropped. However, in the past 2 weeks, that number is on the increase. According to the Indiana State Department of Health, the number of COVID-19 patients using a ventilator or in intensive care units has doubled in the last 30 days.
It's still a very hard and painful time, forcing people to make difficult decisions. And unfortunately, I think all too often people are making decisions that put them at risk and occasionally suffer fatal consequences as a result.
Adding to the already overcrowded hospitals, we are in flu season and at the end of the year, which brings a flood of patients in for surgeries after they have already met their deductibles on their health insurance. Staffing continues to be a problem at all area hospitals. The pandemic has brought on an increase in retirements, and hospitals are moving medical staff from one unit to another with COVID-19 patients. If you are looking for a sign of when this surge might be coming to an end, start looking at the hospital parking lots, and when these tents disappear, that's when we are starting to see the light of day. In Indianapolis, Richard Essex, Wish TV, wishtv.com, and follow us on Facebook.
All right, Richard, let's take a look now at the latest coronavirus numbers from the state. Health officials confirming 59 more people have died. Those deaths happened between October 30th and November 18th. 4,889 Hoosier deaths are now linked to the pandemic, and there are more than 7,400 new cases. In all, more than 275,000 people have been diagnosed.